I can tell you, having treated hundreds of younger women, including in their 20s and 30s and 40s, that when everything is said and done, when chemo is over, when there's been some distance from the treatment that they've had, they don't look abnormally older than we otherwise would expect them to look. But I think when women ask the question, am I really going to look older? I think it points to all these feelings that they may have about body image and what it feels like to go through therapy. And I think it's something that women really need to explore, what they feel with a social worker, with a psychologist, with their doctor, and leave no stone unturned when it comes to how you feel. I think that when somebody's going through treatment, if they're losing their hair, for example, that can certainly affect their body image. It can affect their sense of self. Many of the women who have their hair grow back after having lost it from chemotherapy, this is hair that's never been dyed, never been touched, never been brushed, and sometimes it's this lush, beautiful, shiny hair that we refer to as chemo hair that looked better than their hair before. So sometimes women actually have this new vibrancy that they didn't have before. In terms of the skin, they can absolutely see dermatologists to talk about if they're worried about wrinkles. Can they do Botox? Can they do fillers? What creams can they use? Can they use retinol derivatives? These are medications that help with aging and help with wrinkles. There are lots of things that we can do to still look young even after chemotherapy, and it doesn't necessarily end up that you're going to look 15 years older.